Sciatica is a condition that's often misunderstood or simply considered a bad back. However, it's more complex than that. Sciatica refers to the pain that radiates along the path of the sciatic nerve, which is the longest nerve in the body. This nerve runs from the lower back, through the hips and buttocks, and down each leg. When something irritates or compresses this nerve, it can lead to pain and significant discomfort that's often referred to as sciatica. The pain from sciatica typically follows a predictable pattern. It starts in the lower back and radiates through the hips, buttocks, and down one leg. While it's possible for both legs to be affected, sciatica more commonly occurs on just one side. Sciatica isn't actually a condition in itself. Instead, it's a symptom of an underlying issue, usually affecting the lower spine. Sciatica is surprisingly common, affecting up to 40% of people at some point in their lives. It's most prevalent in people between the ages of 30 and 50, although it can occur at any age. Men are more likely to develop sciatica than women, and certain occupations that involve heavy lifting or long periods of sitting can increase the risk. Causes of sciatica. Sciatica occurs when something compresses or irritates the sciatic nerve. There are several potential causes for this, most of which involve issues in the lower spine or the surrounding muscles. The most common cause of sciatica is a herniated disc. Your spine is made up of a series of bones called vertebrae, separated by discs that act as cushions between them. These discs help absorb shock and allow the spine to move fluidly. When one of these discs becomes damaged or slips out of place, it can press on the sciatic nerve, leading to pain. Another frequent cause is spinal stenosis, which is a narrowing of the spinal canal. This narrowing can put pressure on the nerve roots that make up the sciatic nerve. As we age, the spaces in our spine can naturally become narrower, which is why sciatica becomes more common as we get older. Piriformis syndrome is another potential cause of sciatica. The piriformis is a muscle located deep in the buttock, and it runs very close to the sciatic nerve. In some people, this muscle can become tight or spasm, compressing the sciatic nerve and leading to sciatica pain. Other than these causes, trauma or injury to the lower back can also lead to sciatica, whether from a fall, car accident, or sports injury. In some rare cases, conditions like tumors or infections can cause sciatica by pressing on the sciatic nerve. Pregnancy is another time when women may experience sciatica due to the added pressure on the lower spine and pelvic area. The growing uterus can press on the sciatic nerve, leading to pain that radiates down the legs. Fortunately, in most cases, sciatica during pregnancy resolves after childbirth. Symptoms of sciatica. The primary symptom of sciatica is pain that radiates from the lower back down into the legs. Many people describe it as a sharp, shooting pain that makes it difficult to stand up or walk. Others experience it as a dull ache or a burning sensation. The pain can extend all the way from the lower spine to the back of the thigh and even into the calf and foot, and it usually affects only one side of the body. Along with pain, people with sciatica often report tingling or numbness in the leg or foot. This can feel like pins and needles and may be constant or intermittent. In severe cases, muscle weakness in the affected leg can occur, making it difficult to stand, walk, or even move the leg. The pain associated with sciatica typically worsens with certain movements or activities. Many people with sciatica find that their symptoms are worse in the morning or after sitting for a long time. Movement often helps to alleviate the pain, which is why doctors often recommend staying active rather than resting when you have sciatica. Standing up suddenly or bending forward can also trigger or worsen the pain in some cases. Additionally, sneezing or coughing may also exacerbate the discomfort, as these actions increase pressure on the spine. In rare cases, sciatica can cause a loss of bladder or bowel control. If this occurs, it's considered a medical emergency known as cauda equina syndrome, and immediate medical attention is necessary to prevent permanent nerve damage. While sciatica is often associated with lower back pain, it's important to note that not everyone with sciatica will have back pain. In some cases, the pain is concentrated in the leg or foot without much discomfort in the back itself. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of sciatica. Diagnosing sciatica typically involves a combination of a physical examination and, in some cases, imaging tests. When you visit a doctor with symptoms of sciatica, they'll usually start by asking about your medical history and the nature of your symptoms. They'll want to know when the pain started, what makes it better or worse, and how it's affecting your daily life. During the physical examination, your doctor will likely perform a straight leg raise test. This involves lying on your back while the doctor lifts your leg. If this causes pain that radiates down your leg, it's a strong indicator of sciatica. They might also check your muscle strength, reflexes, and sensation in your legs. In many cases, a thorough history and physical exam are enough to diagnose sciatica. However, if your doctor suspects a specific underlying cause, or if your symptoms are severe or long-lasting, they might order imaging tests. X-rays, CT scans, or MRIs can help pinpoint issues in the spine, such as herniated discs or spinal stenosis. An MRI, in particular, is useful for seeing soft tissue structures like discs, muscles, and nerves, which are often involved in sciatica. In some cases, a nerve conduction study or electromyography may be used to assess how well the sciatic nerve is functioning. These tests measure the electrical activity in the nerves and muscles to detect any abnormalities or blockages. Treatment of sciatica. Treatment for sciatica depends on the severity of the pain and the underlying cause. In many cases, sciatica improves with conservative treatments, meaning surgery is not necessary. Pain relief is often the first priority. Over-the-counter medications, such as ibuprofen or acetaminophen, can help reduce pain and inflammation. In more severe cases, your doctor may prescribe stronger medications, such as muscle relaxants or anti-inflammatory drugs. For some individuals, corticosteroid injections may be recommended. These injections deliver powerful anti-inflammatory medication directly to the area around the sciatic nerve, providing relief that can last for several weeks or even months. Physical therapy is often a key component of treatment for sciatica. A physical therapist can design a program of stretches and exercises to help strengthen the muscles around the lower back, improve flexibility, and reduce pressure on the sciatic nerve. Exercises that target the core muscles are particularly helpful, as a strong core helps support the spine and reduce the risk of future injuries. For individuals with severe or persistent sciatica, surgery may be necessary, particularly if the pain is caused by a herniated disc or spinal stenosis. Surgery is usually considered a last resort when conservative treatments haven't provided relief or if there's significant nerve damage. The most common surgical procedures for sciatica include discectomy, where the part of the herniated disc pressing on the sciatic nerve is removed, and laminectomy, where part of the bone around the spinal cord is removed to relieve pressure. Home remedies for sciatica. Home remedies can be a great way to manage sciatica pain and promote healing, especially for mild to moderate cases. One of the most effective methods is alternating between heat and ice therapy. Start by applying an ice pack to the lower back or the area of pain for 15 to 20 minutes every 2 to 3 hours during the first 48 hours of a flare-up to reduce inflammation and numb the pain. After 2 days, switch to heat therapy by using a heating pad or warm compress on the affected area for 20 minutes at a time, 2 to 3 times a day. This helps relax tight muscles and improve blood flow, which aids in healing. Gentle stretching and low-impact exercises, like walking or yoga, are also highly beneficial. Aim to stretch for 10 to 15 minutes daily, focusing on stretches that target the hamstrings, piriformis, lower back, and hips to ease pressure on the sciatic nerve. In addition to that, certain lifestyle changes can make a big difference in managing sciatica. One of the most important things you can do is to maintain good posture. Sitting and standing with proper alignment can reduce the strain on your lower back and help prevent nerve compression. Avoid sitting for long periods and take breaks to stretch and walk around if you have a desk job. Using an ergonomic chair or a standing desk may also be beneficial for people who work long hours at a desk. Other than that, losing weight, if necessary, can reduce the pressure on the lower back and improve symptoms. Now, we want to hear from you. Have you ever experienced sciatica? What treatments or exercises worked best for you in managing the pain? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.